From the time of its independence, precisely since 1961, Senegal has developed strong ties with the United States of America through USAID, the U.S. Agency for International Development. Diversified cooperation in the field of education, health, economic growth, and natural resources, among others. USAID supported many training programs for Senegalese students and managers at prestigious American universities through scholarship programs for various levels of education. André Sonko, who held several ministerial positions after working in the Office of Organization and Method created by late President Léopold Sédar Senghor, is among the many Senegalese who benefited from such programs. He currently serves as president of Suffolk University in Dakar.
It was an opportunity for us, after having gone through the French system from high school to university, to be exposed to a different education system. I must add that the training I received there, many others have also benefited from it before me and continue to do so after me. Since then, the program has expanded and diversified, and if you look at the alumni director, you will find that many executives have received this training in the United States.
A few decades later, Edouard Msek, a teacher and the current principal of Johin in the region of Fatick, received a scholarship that allowed him to improve his high school environment.
In the US, we are literally in the 21st century campus, as in all schools we visited. We saw more computers than blackboards. Going back to Senegal, I figured I couldn't remain with the status quo but had to think creatively. So I started taking more control over my high school's very environment. I gave more say to the APE, the CGE, as well as the community at large through community forums. Today our budget as well as the various structures of our school can be found straight on our website.
From the first years following independence onward, USAID has helped thousands of young Senegalese gain access to secondary education by supporting Senegal in the construction of schools such as John Fitzgerald Kennedy High School in Dakar, Malick Sy High School in Thiès, and Gaston Berger, now Valdiodio Ndiaye High School in Kaolack. The principal of Kennedy High School's views on the high school, women and leadership, and technical capacity building in favor of women.
À l'échelle nationale, nous avons beaucoup de dames.
Nationally, we have many ladies who have attended this school and who are now in leadership positions. We have, for example, the Minister of Gender, Mrs. Awa Ndiaye, Maître Mame Bassignan, Maître Aïssata Tall Sall. Concerned about the access of young Senegalese to education, cooperation between USAID and Senegal has also focused on the construction of hundreds of junior high schools. USAID also supported the modernization and improvement of secondary schools by providing computers and internet access through the Basic Education Project and the Éducation Priorité Santé Project, a comprehensive health program.
À partir de 2003,
starting in 2003, USAID has supported us both in urban and rural areas. This has enabled thousands of young Senegalese to continue on from primary school to middle school. It is through the establishment of magnet schools that many girls have actually had the opportunity to benefit from secondary school education. These magnet schools are close to the communities so that girls do not have to go hundreds of kilometers from home. They can instead stay in their regions, communities and villages to continue their studies.
Finally, USAID supports public-private partnerships, resulting today in the involvement of 25 national and foreign companies in initiatives promoting the development of education in Senegal.
USAID is a partner of the government of Senegal in the field of education. Altogether, USAID has directly supported the construction of nearby 58 high schools. We also assisted in the construction of about 18 other junior high schools, and this makes USAID one of the primary donors for middle school education.
In close cooperation with the Ministry of Health, many programs have been implemented to improve the health of Senegalese families by improving people's access to healthcare and health facilities. The rural project in Sine Saloum, initiated by USAID in the early 1980s, reflects this new approach to community health through health huts, which constitute a real innovation. Today, there are over 1,600 health huts in 11,000 community health workers throughout the national territory. After the construction of the health hut and the training we received with support from USAID, infant mortality due to influenza and diarrhea diseases declined, as well as maternal mortality thanks to our advances in family planning. One of the main activities that have taken place during the implementation of the community health program is the distribution of long-lasting insecticide-treated mosquito nets throughout Senegal. There are 5 main USAID programs that characterize this cooperation. The Maternal and Child Health Program and the Malaria Control Program develop new strategies to enhance best practice and improve quality of services. As regards to malaria control, Senegal is now considered as a case study because of impressive results that inspire many other countries. Intensification of prevention strategies through information and universal access to insecticide-treated mosquito nets, support for free treatment in case of simple malaria, home spraying, support for research are some of the ways USAID has contributed to lowering malaria prevalence by about 49%.
Cette lutte-là, une personne ou une équipe ne peut pas la mener.
This fight could not be carried out by one person or one team alone. We had to have an environment where everyone felt involved, and that surround sound was a great idea. Our American friends at USAID agreed, and along with Malaria No More, we set up this round sound that saw the participation of Quranic schools, teachers, athletes, musicians, politicians, everyone actually.
The Community Health Program, with its health huts, helps to bring people closer to health facilities and promote the health of Senegalese families, particularly in rural areas. The HIV/AIDS and tuberculosis program supports Senegal in consolidating and strengthening its gains in controlling these diseases. These programs provide psychological support and help with taking care of patients as well as nutritional support. Finally, USAID supports a major social marketing program that promotes products and behavior change regarding reproductive health. The program develops information strategies, advocacy and social mobilization activities tailored to different segments of the population.
The first USAID program began in 1982 in what was then the Sine Saloum region, before turning into Kaolack, Fatick and Kaffrine regions. At the time, you would agree with me that there were not many health facilities to allow people to access health services. USAID is supporting now 1,650 health huts. We believe that this consistency in their support is a factor that has enabled Senegal to maintain a level of prevalence below 1%.
USAID has also marked its presence throughout the evolution of Senegalese economy. From the 1960s, the agency has supported agriculture, particularly in the development of new varieties of groundnut, millet and cowpea, in seed development and pest control. Since independence, the U.S. government, through USAID, has contributed enormously to the development of crop variety in Senegal. It supports research and development of new varieties of peanuts, millet, cowpea, and we are currently working on food security. Therefore, considerable resources have been set up to help the Senegalese government to address the food crisis resulting in the development of certain rice varieties and seeds. Many programs are in place to help people access credit to purchase input seeds. All these initiatives contribute to enhance agricultural productivity. The Senegalese Institute for Agricultural Research, ISRA, is for instance a good example of cooperation between USAID and Senegal.
All research currently carried out at ISRA is mostly conducted by researchers who were trained in the United States. It is really thanks to USAID that ISRA reached the level of technical know-how it boasts today. Currently at ISRA, especially on the site, we produce seeds throughout the year, regardless of the season. We know how to do it, and we are using the equipment that USAID has made available to ISRA to support the process of seed production.
Senegal has also benefited from cooperation in the area of natural resources management and protection. The stretch of Filawos from Dakar to St. Louis, a real green belt, is a living symbol of said cooperation. USAID has had a lasting presence in Senegal through support for reforms and various policies of the government of Senegal.
USAID support between 1994 and 1996 was able to help the private sector gain full control of the import and distribution of rice in Senegal,
to make the economy more competitive, open and conducive to growth. The same applies to the reform and consolidation of banking sector in Senegal.
Senegal's banking system has become one of the most profitable of the entire West African economic community. A major reform was introduced in the banking system to accommodate savings and credit mutuals.
USAID supported the reconstructing of banking system, the privatization and establishment of a collection agency which still exists in the form of the Société Nationale de Recouvrement that can repay customers and bankrupt financial institutions.
ASEP was born with USAID help after an agreement with the Senegalese government to set up a project to bridge the funding gaps. Following the disappearance of development banks in the years 1985-1986, today we finance the agricultural campaign in terms of seeds and fertilizers, as well as the marketing of agricultural products. We also fund small crafts, small industry and women's groups. We grant loans to individuals and groups alike, while helping women overcome the guarantee problems that usually arise by bringing them together.
It is also as part of this reform that the unit was created with funding from USAID to provide regular and comprehensive information on the rice market. As far as the partnership between USAID and Senegal is concerned, there are at least 10 reasons to be proud. Strong growth in access to basic financial services through ASEP, fourfold increase in use of ITNs in 4 years, health and child survival in rural areas, reform of the rice sector, construction of schools, land tenure issues and land management plans, low-cost control, training of development actors, banking sector reform.
USAID has been partnering with Senegal for 50 years. We work together to find the best ways towards the development of the country. Certainly in the health sector, we have been working with the government for years. The new malaria control program is one example. We are very proud to partner with the government, who has succeeded in maintaining a low prevalence rate. We have also worked with the government in agriculture as well as natural resources management.
The partnership between the agency and Senegal has been instrumental in creating a critical mass of local expertise, as well as enabling the emergence of more socially conscious and useful organizations. The private sector, non-governmental organization, and the public at large are increasingly reaping the benefits of economic progress, education, and health. The Mission Director of USAID on cooperation between Senegal and USAID. Cooperation between Senegal and USAID is based on shared values.